So here we imagine that we have a tooth that has two cavities. You see, we do a temporary filling. Why? Because once we have trimmed everything, we need to do a temporary crown there. So now this is a cement, a temporary cement. So you just imagine we're in the mouth. Yeah? Imagine this is the mouth of the patient. Actually, what you see here, the gum is, the pinkish gum is wax, pink wax, and the crown of the tooth is just wax. Yeah? Dentin-looking wax. And you see the two cavities? So we mimic a situation in the mouth. Yeah? So we model with the temporary cement, and we take temporary cement to do the same on the... But we didn't clean the cavities. Of course we didn't. We will do it afterwards. But first of all, please remember the shape that we have. Morphology preservation technique. So please remember this. Morphology preservation technique. I don't want to lose what I have. And what I don't have, I model it in accordance to what was left, to what is left in the patient's mouth. Yeah. We can use this very cheap cement, or why not, we could use a composite. Yeah, there's always some composite that is going to expire in your office. So it's not going to be expensive because anyhow you have to throw it away. It expires. Yeah. You'll always have this. So we make the tooth look as much as possible as the initial shape of the patient's tooth, right? And the important thing is to copy this morphology, because this morphology will copy it with CAD/CAM techniques up to the end. So the patient will have a restored tooth that will be identical to the original. Yeah, that's the level of precision that we want to work with now. Of course, when you do this, you can use some water, or the best thing is to use a little bit of saliva. There's always around, so you don't have to buy it. So if you do it in composite, you have even better morphological results. And now this is the pistil from which you express the index material. The index material is a addition silicon in a tray. That tray is called TEM tray. Very nice tray. It's aluminium. You can modify it if you need it wider or... And now we place this material, this silicone, to make an index. Yeah? It's not a putty. We keep the tip in the material, and once we're done, quickly, there's no time to waste, 30 seconds set time. Okay? You just press it there. That's fantastic. That's the best way. Of course, it's much more expensive. It's more expensive than the putty, but the results, come on. And your time is important, because you do this in the mouth and you don't have time. The next patient's at the door. Okay, time is money in dentistry, so please remember that. Yeah. And now 30 seconds is set. You just take it away. You have your index, and you have your index in a tray. That means the margins of the index aren't flexible. Yeah. Take it off. We scratch a little bit, we take out the cement that we placed, we clean everything up. We could use some water and air maybe spray. You clean this index. If you did the fillings, the temporary fillings in composite, you don't need to do that anymore. And with this thing, we will do initial temporary restoration. That can be left there if the technician is doing the final one quickly. Then you don't need another lab-made temporary. Now, you see, we have the index and we have the abutment in the mouth. Yeah? And we place our resin, we just inject it. That's office-like resin. Yeah, it's more expensive because dentists have more money than technicians. That's how it goes. Yeah, they charge patients more and so on and so on. So we can afford such wonderful materials. 2 minutes setting time, it depends. Around 2 minutes setting time, and you press it. Of course not on the tooth, because you trimmed the tooth. You cleansed everything from the tooth. The cavities are not there anymore. You want to make a temporary crown on the tooth that you have prepared, right? And this is one of the resins that can be used. It's a very good one from Clinician's Choice. Yeah. So that's the crown. So nice. So nice at the margins. Of course, because I had such a wonderful index material. And now slowly you take it off from the model. Just imagine and remember, we are in the mouth now. Yeah, we are on a model, but we act as if we were in the mouth. We mimic the mouth. And you see the abutment and the temporary. You see the margins of the temporary, how clean they are, how nice they are. And of course, we have to trim it now and to polish it. And then we have it. That's it. Directly in the office. Yeah. And now we take the impression, because we want to send the impression to the lab for a better temporary, if the case requires it, or for the final restoration, if everything is okay. This is a retraction cord. I don't like this retraction cord. I haven't been using it for 10 years now, but anyhow, this is a very old movie. That's a cord that has copper inside, and it's kind of difficult to place. This retraction cord, we place it there in between the gum and the preparation, the abutment, at the cervical region zone, to allow the impression material to capture nicely the margin of our preparation. Actually, what we're doing here, we're pushing a little bit the gum away. Not too much, because if you push it too much, and if it hurts, and if the patient says, stop, then no, please don't, then you have a problem. And to do an anesthesia and to press it even more, the patient doesn't feel, but then your gum will retract, because you just over pushed the retraction cord. So the retraction cord is to be placed nicely, almost without anesthesia, almost without anesthesia. And don't push it too much, because the gum will retract and you will have short crowns. But you need this retraction cord many times when the preparation has gone a little bit subgingival, because you want to keep the gingiva away from the margin of the preparation, right? In order to allow the impression material to capture everything. And now you see the cord is too long, so we have to cut it. Of course, we don't use this in the mouth, but that was just a demonstration for students, right? So we cut this, and we don't want to have overlaps. We want the retraction cord to get head to head. Now the problem is, you see, this retraction cord is white. And if you have a little bit of bleeding, it becomes pink. If it's pink, you don't see it, because gum is pink. And that's why I prefer retraction cords that are black or green or blue. Yeah, something that makes contrast with both dentin, which is yellow, and with gum, which is red, pinkish. Anyhow, so now we placed it. And some techniques require double cord. I don't use those techniques. I don't like them anyhow. But some techniques require this. We we want to avoid the putty from getting on the preparation itself. So you don't imagine that this second cord will get into the sulcus, because then the sulcus is what? To park a tank there. There's no such sulcus. Now this is to be placed over the margin of the preparation, just to prevent the putty from getting to the margin of the preparation. And you say, why do we want this? Because what we want to have there is only the fluid material, the very, very precise impression material, not the base of the impression, which is the putty. And so that's why some people, they put 2 cords. But about impressions, that's another discussion, which is the best type of impression. Again, we'll talk about this again when we do dental materials in the 3rd grade. So again, you want head-to-head closure of the cord, of the retraction cord. So that's our preparation for the step 1 of the impression, which is the putty. It has to be nice, dry. And now we take the impression. This is a putty material addition, silicone. How do I know? Because it's 1-to-1. There's one amount, one quantity of base, as you see it. Base is always the color. And the equal amount, it doesn't matter how much, but it has to be equal. An equal amount of catalyst, which is always white. Yeah. You see, there are 2 spoons, because you don't have to mix. You don't have to have a little bit of white getting into the color. That's a little bit of catalyst that goes into the base, because it will catalyze your whole base and you have to throw it away. So keep it color for color, right? White, use only the white spoon. For the color, use only the color spoon. And you have the 2 together and you mix them now. This is addition type silicone again. Putty, addition type silicone. That's the first step of the impression. And this is how you move it. You make it round and then you press it. Make it round and then you press it. Make it ball-like, round, and you press it. Until you don't see the difference of color anymore between white and color. Until there's only one even color, right? Once you've done that, you create like a cylinder-like shape, and you place it in the impression tray. See, that's the moment. It's like a sausage. And you put it in the tray. Nicely. And now you place the impression tray, not from back to front, but straight on, like an elevator, like a lift that goes up. Whoop, slowly. One move, one shot. Don't put too much pressure. Or if you do, then release the pressure. Okay. So you have to understand, this is what happens in the mouth. But I'm not in the mouth of the patient. Now it's a demonstration on a model. But this is what dentists do in the mouth. Never touch the handle. The handle is just for cleaning the tray, maybe. Okay? From the premolar zone, you push it down. Okay. Now you remove the first cord. That was, again, just to prevent the putty from getting into the details of the preparation of the margin. And now we place another type of material. This is another silicone, but this is very, very thin, good-looking, nice-looking silicone. I could have had a tip to put silicone around the preparation. Now I don't have this tip here in the demonstration, so I put everything in the tray. You can do it both ways. So you see, this is the fine addition silicone, second step of the impression. And of course we add to the neighboring teeth. You'll say, why? Why the neighboring teeth? Well, that's important because you need to have a very, very nice aspect of the occlusal surfaces in order to be able to combine the upper and lower model and to get the best occlusion possible. Okay, and we do the same thing. We place it again slowly, not much pressure, slowly, and then if you press a little bit more, okay, then you relieve the pressure and you stay like this. That takes around 3 minutes. Of course, in the mouth we keep the tray on the mouth of the patient, on the teeth. We keep it with the finger. And then we have to remove it again from the premolar region. Maybe you could blow air there, or the assistant can blow air under the impression and in between the impression and the gum. And then it simply pops up like this. And that's the preparation, you see. And on the preparation now we can put the temporary preparation, the temporary crown that we made previously, and check whether everything is fine. Again, if the technician is doing the job quickly, then we can leave this temporary for, I don't know, 1 week, and then in 1 week the technician will give us the final restoration. So we have to see where it has high spots and trim it and polish it, and yeah, that's it. Done in the office. See, now we want to check the articulation. You say, okay, but this is the temporary. Yeah, it is a temporary, but we don't want to have the jaw of the patient deflect from the condyles in order to avoid high spots. We don't want this to happen. So the temporary crown has to be as perfect as a final one. You see the points, and now there you have to bring the micromotor and the burrs and to, But this is, we don't do this like this on the model. Again, we pretend here to be in the mouth of the patient, so we ask the patient to bite slowly, slowly, not too strong in order to avoid breaking our crown. It's a plastic after all. And then once you're done and you trimmed everything and you see that you're okay in the occlusion, then you use temporary cement it and you send the patient home. Patient happy.